Okay, so I'm going to talk to you today about belonging and why belonging is so important for all of us, but especially for our children that have experienced some sort of care. So we're going to talk about belonging kind of more globally, but we're also going to specifically be talking about a research study that a couple of colleagues and I conducted a few years ago on some adults with care experience. And I just want to take a moment to acknowledge them. So the study has been published in a peer-reviewed journal. We paid the money to get it open access. So if you want it to send to your board or anyone that you know, send it to your grandma, right? Anyone can have access to it. We also have an infographic that kind of explains all of the things in a brief summary. Email me. I'm happy to share that with you. We want this information to get out into the world, and all of our references are in there. So I just want to acknowledge my colleagues that helped publish this work. So Dr. Nicole Wilkie, who you heard from earlier, woohoo! Tony Mitchell, if any of you are familiar with Tony, he worked at CAFO for a number of years and is very involved in the CAFO community. My student Lindsay Newsom, who is finishing medical school, so if you're looking for a pediatrician in the near future, and then my student Megan Roberts, who's now a clinician in the state of Alabama. So their work was imperative to making this go forward. So, big button. Boom. Let's talk about sense of belonging. So when I talk about sense of belonging, this is more than just being in the room with others. This is the difference between being accepted and invited into a conversation versus just sitting there. This is walking into a classroom and feeling invisible versus walking into a classroom and having someone call you by name and ask you to come sit at their table and ask about how your day was. So when we're talking about this idea of sense of belonging, psychologists have long known and long recognized that belonging is a fundamental human need, just like food, just like water, just like shelter. And if people go extended periods of time without the sense of belonging, they suffer psychologically and they suffer physically. You probably have all experienced this. So think about your first day at a new job, or your first day at undergraduate, your first day in a new school, right? It's the difference between showing up and someone saying, hey, welcome, my name's so-and-so, how are you? How did you end up here? Come sit with us, come talk with us. And you probably feel pretty welcome, you probably feel pretty safe in that environment, versus that not happening. And suddenly that same experience, you're feeling a little anxious. Right? You're feeling a little bit isolated. So we're going to talk a little bit about what this has to do for emerging adults, and particularly for emerging adults with care experience. So when I talk about emerging adulthood, this is roughly between the ages of 18 and 29. We get kind of vague when we talk about emerging adulthood. But what we all know is that emerging adulthood is already a really difficult period of time. You're figuring out housing and education and work and identity, right? And it's something that we all kind of struggle with during that 18 to 29 period of time. But for our young adults that have care experience, so for example, those that were in foster care or residential care or in kinship placements, this is even more magnified for them. Why? Because many times they lack that social network and that kind of safety net that we all had. How many of you regularly called your parents at 18 and 19 with questions like, so, taxes, tell me about that? Or, we're 5 days to the end of the month and my bank account has $2.57. Is there $50 that I could borrow just for a little bit? Right? So think about going through and transitioning. For our adults with a care experience, many of them age out of care at 16 or 18 or 21 if they're really lucky. And then suddenly they're expected to do it all on their own and know all of the answers on their own. I spoke with a gentleman a couple of months ago, and he at the time was 25 when I was talking with him. But between the ages of 14 and 18, he was in 4 separate foster placements. And he said for the first 2, he really tried. He really, really tried to integrate himself into those communities and into those families. But every single time he moved, he felt like that rug got pulled out from under him. And he's like, by the 3rd placement, I gave up. By the 4th placement, I barely even knew anyone. I sat at my own table at lunch every day. And so when he transitioned out of foster care, he had no one. He had no community. He had no social safety net. He had no one to talk to about how do I do my taxes? How do I change my tires? So this is really, really important, not just for emerging adults in general, but specifically for adults with care experience. So how does this sense of belonging play into this? What do we know? What have we learned about sense of belonging? So a few years ago, we did a very large-scale study with adults with care experience. This is a piece of that study, and we had 703 adults from 16 different nations. And what you see, this is truly a global study. We had individuals from India and Kenya and Poland and Romania and Thailand and Peru, truly a global sample. And we asked them lots of questions, but one of the questions we asked that we were really interested in was, when you were in care, was there ever a time or a place that you felt like you belonged? And 42.6% of our sample said no. There was never a time in care where I felt like there was a time or a place where I belonged. And that has huge implications. So, what did we find? Okay, good, it came. What did we find? In essence, having a sense of belonging had a huge, measurable impact on long-term outcomes for children that experience care. We know that those that had a sense of belonging had lower rates of homelessness as adults. We know that those that had a sense of belonging had lower rates of serious consideration of suicide. They had long-term higher life satisfaction, and they had more resilience. So this ability to bounce back, all from simply feeling like there was a place or a time when they were in care where they felt like they belonged. So these are not just patterns limited to a country, right, or a region. This is a global trend because this is a fundamental human need that every single one of us has and every single one of us experiences. So what does this tell us? Oh, skip it past that one. So what do we do with this, right? What do we do with this knowledge? So what do we do with this knowledge? How can practitioners and organizations and policymakers carry forward and really think about how do you integrate this idea of sense of belonging? The findings are very clear, right? Interventions and policies should prioritize belonging. When we're talking about this, and all this really means is that the kids that are in our care, both while in care and after they transition out, they need consistent, supportive relationships. Consistent, supportive relationships. And this means that we need to, as service providers, it can be something as simple as when we're working with a child in our care, or when we're working with someone that has transitioned out of our care, we ask them, what is something that we can do to help you feel like you belong? It is that simple, and that opens the door to a dialogue where you can meet their individual needs. We can also train our staff and our volunteers to try to intentionally create and build community. So this could be things like group activities. This could be things like mentoring programs. This could be things like peer support networks. I was working with a young woman who had been in residential care, and she was really struggling. So about the age of 16, she was considering leaving the program, dropping out of school, and just going to work. And at 16, she got invested in a church community. And she would go every single week, and she said, I could tell from the very beginning that whether or not I showed up really, truly mattered to them. And this was her network. This was her sense of belonging. And when you ask her now that she is a grown woman with a PhD, she will tell you the reason that she graduated from high school is because she felt like she belonged at that church. And there were people that were invested in her being successful. So what should you carry forward? What should you take from this? What we know is the research shows that having a strong sense of belonging makes a measurable difference in the lives of children with care experience. It lowers risks, it increases resilience, it improves well-being. And here's the really good news. Belonging can happen anywhere. It can happen in easy ways. We can foster it. It does not take massive policy overall at your government level or even at your organization. What it takes is making the time to make sure that the children in our care feel like they are valued and listened to and a part of. So, kind of as my closing thought for all of this, belonging is not just a feeling, it is a protective factor. And it is a protective factor that all of us can cultivate together. So thank you for your time. I hope that you walk away knowing that belonging isn't optional, it's essential, it's a fundamental human need, and that for our children that have care experience, it can make the difference between surviving and truly thriving. So thank you for your time.